Today in the office, one of my patients stopped me and she says, "Hey, Dr. Jen, I've been meaning to ask." She says, "Why don't doctors prescribe natural remedies? Why don't they prescribe holistic treatments? I mean, you all are willing to prescribe medications, but what about the natural things? And why don't doctors prescribe them?" I thought about it. It's an excellent question, and I realize and know that a lot of you have asked me these questions as well. I can also tell by the comments on my videos that you sometimes wonder about this. Let's talk about it. Okay. One of the main reasons that physicians don't prescribe natural remedies, and let me stop right there and define what I'm talking about when I say natural remedies. I'm going to talk about the remedies that my patient was referring to, things like supplements, vitamins, botanicals, herbals, and there are plenty of other things that are considered natural, but let's maybe focus on that, okay? Because it's hard to sort of encompass everything. But in terms of like vitamins and supplements and botanicals and stuff like that, it's hard for us to prescribe them because there's not always a lot of evidence that shows that they work, period. Or that shows that they work as well as some of the prescription modalities and medications that we have and other medical treatments that we offer. When it comes to medicine and medical school, we take this oath of doing no harm. And one of the ways that we are taught to determine how to treat patients, how and what to offer patients, we're taught to do that in part based on, the evidence that we have that something works. It's not the only way that we're taught to prescribe something, right? But that is one of the mainstays. We want to give patients and give you something that's actually going to work for you. How do we know if something's going to work? Well, we have to use the best information and look at information and put it all together and pick the things that have the best information, the most concrete information, the most compelling information. And often, in terms of vitamins and supplements, botanicals, herbal things, etc., we don't have that information for them. So it's not to say that supplements and vitamins and things like that don't necessarily work. Again, I know I'm being very, very general here, but you kind of get my point, I hope. So I'm not saying that they don't work. I'm just saying that we don't always have the data to prove that they do. We don't always have the data to prove that they work as well as other things that we do prescribe. That's one major reason why a lot of doctors do not prescribe vitamins and supplements. And you probably have found that many of us are very much alike, right? Traditional physicians, we practice very similarly. And that makes sense because that is how we are trained. And I believe firmly in that. Now, what I will go on to say is that when my patient asked me this question, one of my first thoughts, I have to say, was, wait, we prescribe natural stuff all the time. And I didn't say that to her, but in my mind, one of the things or some of the things I talk to my patients about literally every single day is maintaining a healthy weight, eating a healthy diet, exercising, minimizing stress, getting enough sleep. Making sure that we are sort of, not smoking, minimizing alcohol. In my mind and in my definition of what is natural, those are some of the most natural things, in my opinion, that can be done. Those things don't require medications or supplements or anything else, really. They require us, and yes, with weight loss, yes, sometimes that requires medications, but you kind of get my point, right? When I think about natural, I think about sleeping more, sleeping better, dedicating, using sleep hygiene to get to sleep and have a better night's sleep, reducing stress, not smoking, exercising. Those are so natural, eating healthy. And what I think is sometimes very interesting is that, those are some of the things, some of the most effective ways to lower our risk for things like diabetes and heart disease and high blood pressure, many of the conditions that my patients are looking for natural remedies for. So while some of my patients are looking for natural remedies for these, the most effective remedies that we know of are actually exercise, diet, maintaining a healthy weight, not smoking, etc. And I think what's sometimes tough for me is that we don't always think about those as being natural. I know that our current definition of natural and holistic tends to be, or often is, things like supplements and vitamins, etc. But I want to remind you that, in my opinion at least, what's truly natural are many things that we can do without the aid of much else at all. How to live a healthy life, how to minimize stress. Again, I don't want to go through all these things, But I encourage you to think about those things as being natural. When I talk about natural remedies, that's what I'm talking about. And we do have lots of evidence that those natural remedies actually make a huge difference in our lives. Our blood pressure, our cholesterol, our stress, and so many things. So, when my patient asked me, why don't doctors prescribe natural remedies, I knew she was referring to supplements and vitamins, and that has to do with evidence, okay? Why would I prescribe you something that I'm not sure if will work when I have things that I know will work and that I can quantify or at least estimate with some certainty potential side effects or potential risks? It's about keeping you healthy and safe with as minimal risk as possible. Now remember, medications have side effects just like vitamins and supplements, but at least with medications, we tend to at least have a decent idea about what many of those side effects may be. Now, medications are not perfect. I'm not saying that medications are great. That's not what I'm saying. I'm just saying this is often why we refer to things like medication, surgeries, etc., instead of things like herbals and supplements and botanicals and stuff like that other people consider natural. So I would just encourage you to sort of think about that. The other thing I would do is that, I think I've also heard and seen people say, like on my videos, that we don't prescribe natural remedies because we wouldn't make money, that we make money off of prescription medications and drugs, and we shouldn't be. That is actually, we're not allowed to. We can't, and we shouldn't be. And that is actually a very, very big no-no. I don't make money, kickbacks off of prescription drugs. That's that I write. That's not okay. And doctors feel that way. No, we don't make kickbacks, and we don't get paid more, from writing a certain medication. That's not why we write drugs or write for prescription drugs as opposed to natural supplements. I would argue that for most of us, it has to do with what we can, to the best of our ability, guarantee will help you the most. That's just sort of a 50,000-foot view. There's lots of more arguments that probably could be made. I'm not being all inclusive. Any docs or health care providers, if you're watching this video, please weigh in below. Let us, give your spin. The other thing I would say is that a lot of people say that we healthcare providers want to keep patients sick. I did a whole video on this, and no, we don't want to keep people sick. In fact, we actually get dinged by health insurance companies, by other providers and overseers, people that oversee us, checking our performance to make sure that we're doing the right thing. And honestly, no, we don't want you to be sick. It breaks our heart when we can't help. So I just wanted to say that too. We love you. We really do. And we often think of you, our patients, as family. If only you knew how much we think about you. We're not perfect, and we make mistakes. But I do want you to know that not prescribing supplements doesn't have anything to do with not wanting to treat you the best or the right way. Anyway, let me know what you think. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I'm on Facebook. Please like and follow my page. On YouTube, please subscribe to my channel. Click the little bell for updates. I do daily videos. Please subscribe to my health newsletter. Go to my website, www.drjencaudle.com. Also, I'm on TikTok, WhatsApp, etc. Guys, love y'all.